So you guys caught me on a day where I have to write an article. I don't have to write some of these things, I just like to. One of the things that I want to write about, and I was asked to write about, is the fact that chiropractic is evidence-based and how we can use certain things, certain tools that are out there to sort of strengthen what we do as chiropractors. Sometimes they call them guidelines, sometimes they call them best practices, recommendations, but just to sort of bring everybody up to speed, when I treat my patients, when they come into the office, I want to make sure that I'm using the best possible therapies for them. I want to make sure that what I'm doing on my patients is backed up by not only sound science, but published research and good theory, and even in some cases, expert opinion. So I take all of that into consideration when I treat my patients. And one of the things that some people may not be fully aware of regarding us chiropractors is that, yeah, there's a whole lot of science behind what we do. Huge amounts of science could fill volumes, bookshelves, whole libraries even. The principles behind chiropractic, the principles behind manipulation are, manipulation's been used for thousands of years. Chiropractic is about 124 years old. And so it's been around for a while, and in that time, research has been done to determine what works the best. How long should people be coming for therapy? When do I refer out, or when do I seek a consult from another practitioner? And what happens when those things get put into research papers and they eventually get vetted through experts in our profession and in other professions too, they come up with what's called a guideline, right? And guidelines are things that can help the average practitioner provide the best possible care for their patients. Now, they're not recipe books. One of the things that we still want to always stress with people is that everybody's an individual, and sometimes therapy will necessitate a little bit of a different approach. And that's okay, and it is consistent with guidelines. When we look at some of the guidelines that's been formulated for chiropractic, for soft tissue injuries such as whiplash, sprains and strains, arthritis, disc herniations, we find that one of the most important things is the process of care. Are we doing proper reevaluations? Are we timely in our reevaluations? Are we checking in with our patients to see if we're addressing their pain levels and their function? I'm not only interested in pain, but I'm also interested into how my patients are functioning on an average basis. I want to know if my patients are able to play golf again, or I want to know if my patients are able to bend over to pick up their grandchildren. That's important to me. And what's consistent with all of the guidelines is that we constantly sort of reevaluate our patients. Every few weeks, we actually check in with them and say, how's your pain levels? How are we doing? Are we going in the right direction? If we're not heading in the right direction, sometimes we'll provide a referral to another provider, or sometimes we'll just switch up some of the care in the office. One of the things that is a constant struggle for chiropractors is maintaining a consistent and a systematic approach to dealing and handling with research. These days, it's drinking from a fire hose. How do you read all of these studies? I have bookshelves full of studies that I'll never get to. Well, the answer are things like guidelines and best practices recommendations. We've done the work for you. Our scientists in chiropractic, our researchers, we've done the work for you. We've looked at all these papers and we've integrated them and basically analyzed them and put them into these papers called guidelines, best practices documents. And one of the things that's consistent with evidence-based medicine, what we want to strive for is this triangle, or so we call it sometimes a three-legged stool. I want, as a practicing provider, to provide the best possible care for my patients. In order to do that, I'm going to incorporate three things. I'm going to incorporate the best available scientific research. I'm going to marry that with my own expertise and experience over the last 20 years. Sometimes there are some techniques, sometimes there are some procedures that don't have a whole lot of published research behind it. What we would call a gap in the literature or a gap in the research. What fills in those gaps? Things like my expertise and experience. And the third leg of this stool is if you're a patient, your preferences and values. I have to take that into consideration. Remember, this is about you. This is not about me. My practice is not about me. It's about you, the patient. It's about someone who's coming into my office that wants to pick up their grandchildren again, play golf again. It's about you, and you have a say in that. And one of the things that we try to impress upon our patients is that you do have a say. Your voice matters. A lot of the decisions that we make in the office are driven by the best available scientific evidence, but you also have a say in that. You have a say as to which direction we go. Ultimately, the choice is always yours. So again, I'll get back to writing this thing. Just wanted to take a little aside and talk to the camera and tell you exactly why it is that the chiropractic profession is always striving for best practices, to do things that are always consistent and in line with current guidelines, current research, and our own expertise and experience. But remember, it's always about you.